You may have seen commercials on TV about PrEP medications, which are drugs used to prevent HIV infections. The commercials tend to be geared toward the LGBTQ plus community, but we all know anyone can get HIV.
With Orlando ranking third in the U.S. in terms of new HIV diagnoses, morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor how it all works.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, the goal of the PrEP drugs is to prevent the infection from happening in the first place. And one of the misconceptions is that these drugs are only for people in the LGBTQ plus community. But data from the CDC shows that about half of new infections occur amongst heterosexuals. Long story short, anyone can get it. So I spoke to Dr. Courtney Paradise, a gynecologist with Orlando Health, about the two different PrEP drugs.
Truvada is approved for anyone. Descovy currently is only approved for cisgendered men and trans women. They're both manufactured by the same pharmaceutical company, Gilead. And that's important too later on because most insurance companies will cover PrEP. However, if you are having trouble getting that medication covered, there are assistance programs through Gilead that will help you pay for that medication if you need it. So PrEP, if taken once daily, you have to take it every day for it to work effectively, can prevent HIV infection with a 98 to 99% efficacy.
Now, Dr. Paradise says the most important thing is to know your HIV status, especially if you're considered high risk. But here's the thing, you don't actually have to be doing anything considered risky or quote unquote wrong to get HIV. All it takes is one time with a partner who has no idea that they have it in order for you to get it.
So about 15% of individuals with HIV in the United States don't know their HIV status, meaning that 15% of people that have HIV don't know that they have it. And specifically, half of those individuals are in the age group 13 to 24, and another quarter of them are in the age group from 24 to 34. So it is very, very important to know your HIV status and then also have that open dialogue and discussion with your healthcare provider if you are somebody that you feel like you are at a high risk of get exposure to HIV. So it's very important that you have that discussion with them because you deserve to have a healthy and safe sex life.
So that may be a pretty uncomfortable conversation to be having with a provider for some people. First of all, remember that these providers have seen it all and you're far from the only person having this conversation. Also, they're not there to judge you. They're there to help you stay healthy, and they'd much rather have the conversation and help you get tested and get you on PrEP to prevent an infection than you come to them later and not know what was going on. Plus, if you're really uncomfortable, there are easy ways to get tested for HIV and other sexually transmitted infections at home.
There are many tests available that are over the counter at local drugstores that use either finger prick testing or an oral swab for saliva that will test for HIV. There's also some tests that you can send in a urine sample as well to test for other sexually transmitted infections. And these tests, they're pretty sensitive at detecting a chronic HIV infection. So, if your exposure was within the last 90 days, it is also recommended that you retest.
Now, Dr. Paradise says if you do test positive for HIV, don't panic. Just get to your provider right away. She says treatments have come a long way, and there are plenty of drugs that can help you manage a long and healthy life. It is not a death sentence the way that some people once thought that it was. And she's a great doctor to talk to, very open, and we're lucky to have doctors like her in our community.